So yesterday there were 1,572 new cases of coronavirus in Victoria. One of those was internationally acquired. 1,571 were acquired locally. That brings us now to 19,861 active cases of coronavirus in Victoria. Very sadly, 13 people have lost their lives in the most recent reporting period to COVID-19. These were a man in his 50s, a man in his 60s, a man in his 70s, and two men in their 80s, all from the Whittlesea area, a woman in her 90s from Darebin, a man in his 80s from Hume, a woman in her 80s from Moonee Valley, a man in his 70s from Brimbank, a woman in her 70s from Banyule, a man in his 70s from Moreland, a woman in her 60s from Stonington, and a man in his 60s from Nillumbik. Can I take this opportunity of passing on our deepest sympathies to the families, friends and communities of those Victorians, and we pay our deepest sympathies and concerns to all involved. There are currently 705 Victorians in hospital with COVID-19. 146 of these people are in intensive care unit, and 92 of those are currently on a ventilator. Yesterday there were 79,200 tests processed, another daily record, and I want to thank every one of those tens of thousands of people for coming forward and getting tested. It is a very important thing to do to help us get ahead and turn this wave around. There were also 38,072 vaccines administered through state-run clinics, and many more than that delivered through the partnerships that we have in place with our GPs, our pharmacists and our other community providers. As of yesterday, 87.1% of the 16-year-old and over population of Victoria had had their first dose of a COVID-19 vaccine, and 60.9% had had their full second dose. As a result of the changing patterns of the COVID-19 in the Mitchell Shire, the Chief Health Officer has recommended that Mitchell Shire be released from its lockdown as of midnight tonight. The Mitchell Shire vaccination rates have really taken off over the last few weeks, and that's an outstanding effort by those communities. And whether it's unlinked cases whilst infectious in the community, they've all stabilised, and the public health team are confident that that outbreak is now understood and is being well managed, and that Mitchell Shire will come back into alignment with the rest of regional Victoria as of midnight. The limited reasons to leave home and the 15-kilometre travel radius will no longer apply in Mitchell Shire. As part of our drive towards 70 and 80% double dose, we are continually looking at how we refine and drive down to the community level our vaccination program. So over the coming weeks, we will be rolling out a local neighbourhood pop-up vaccine program, which means Victorians will be able to get vaccinated in an increasingly vast array of places, be they gyms, be they local clubs, shopping strips, culturally safe locations in an increasingly diverse and really localised range of settings. The first of these neighbourhood pop-ups is opening today at Degani's Coffee in Mernda Junction in Melbourne's outer north, with more Deganis locations to follow, particularly in our high-risk local government areas that are the subject of our greatest attention. These neighbourhood pop-up models are designed to support Victorians to get access and vaccine, Pfizer in particular, in the most convenient, familiar and easy to deal with locations. And equally in culturally safe and protective locations for those Victorians who might need that further reassurance as to the need to come forward and get vaccinated. The pop-ups will vaccinate dozens of people over 2, 3, 4 hour periods of blitzes in those local communities, and they'll be delivered in partnership between the government, local GPs, local community health organisations, St John's Ambulance and a range of other discrete local providers. There are no bookings required at these neighbourhood pop-ups, and they will be in place with marquees, in shopping strips and, as I say, community centres, popular retail food and really localised areas that are familiar with and accessible to the communities we need to come forward and get vaccinated. Neighbourhood pop-ups are also planned with several neighbourhood houses in different communities and Foundation House who will host vaccine offerings for newly arrived migrants, refugees, asylum seekers and those people who so far have been marginalised from the mainstream vaccination program. Local engagement strategies are also part of this program, including, where it's suitable, door-knocking programs to make sure that everybody has access to vaccinations. Suburbs that are part of this program are going to be concentrated in those areas of concern, whether it be our mid and outer north, our western suburbs and in the southeast. Particular focus on Broadmeadows, Craigieburn, Glenroy, South Morang and areas that continue to emerge as hotspots for more vaccinations. This all comes about as we've reached another milestone of 60% of Victorians now being fully vaccinated over the age of 16, and that's a significant achievement as we drive towards both 70 and 80% double dose and delivering on the national plan and Victoria's roadmap to reopen safely, carefully and sustainably.